4:31.
Let me call this meeting to order.
Hi, Penny.
Hey,
Welcome everyone that's tuned in to our Zoom meeting for the Monroe County Board of Health. I'm Kay Leach and I'm serving as chair for the Board of Health. And I'd like to ask the my fellow board members to introduce themselves. Let's start off with you, George.
My name is George Hageman. I'm a retired microbiologist from Indiana University. I've been on the board for a long time. Carol and I are vying for longevity supremacy here. I don't know exactly when I joined, actually, but I'm a member.
Well, I think this community owe you and Carol a debt of gratitude because you've seen PCBs, you've seen AIDS, you've seen COVID. I mean, you've been around for the big things that have come in and hit the community. So thank you both. Mark?
I'm Mark Norrell. I'm a senior lecturer at Indiana University in the Healthcare Management and Policy program at the O'Neill School.
Steve?
Hi, I'm Steve Pritchard, retired dentist, longtime board member. I guess I kind of caught the tail end of PCBs, but pretty much the hard work had already been done by the time I joined the board. But anyway, good to be here.
Carol?
Carol Taluki. I'm a retired pediatrician, been on the board for a while.
And Dr. Wren?
Bob Wren, retired OBGYN physician, been the board member about 4 or 5 years.
And next, I'd like to introduce our administrator for the Monroe County Health Board, or not board, but Health Department, Penny Cottle. Penny.
Penny, I'm Penny Cottle, the administrator, and I have been the administrator since 2008.
And our health officer, I know he's out there somewhere,
Yeah.
Dr. Tom
Hey,
Sharp.
there you
He's
go.
in the office with Penny.
I'm sitting right here, yes. Dr. Tom Sharp, I'm retired family practice, but I've been a health officer for many, many years.
And both of you don't have to wear a mask because both of you know that you've been vaccinated. So it's good to see your face.
Absolutely.
Okay, and I don't know if she's here yet, but we're expecting our legal advisor, Margie Rice. Is Margie on yet? I don't see her on the screen. I understand she's coming, so we'll introduce Margie when she gets here. Okay, next I'd like for you to look at the agenda. And as we alluded earlier, we're going to have to shift some things a little bit today and change the order because we do have a couple board members that have previous commitments and they have to leave early. So if you've, Michelle, can you put the agenda on the screen?
Yep, give me one moment.
Basically, what we're going to do is just change the order. So let me just call them out. First of all, we'll have call to order. We've already done that. Public comment. I'll ask for that in a minute. And then approval. And then underneath public health reports, we're going to put that near the end. And the next, and for D, we're going to have the electronic attendance meeting policy. Hopefully Margie will be here by then. And then E will be E as old and continuing business. And then we'll do our public health reports. And then we'll end up our meeting with board member comments. Does anybody have are they opposed to the changing of the order of the
Nope.
agenda? Can I hear a motion that we accept the agenda as amended?
I'll move that we accept it as amended.
Thank you, Carol. Do I hear a second?
I'll second, George.
Okay, let's do our roll call. George, George, you vote
Yes.
yea? Okay. Mark,
Yes.
Steve,
Yes.
Carol,
Yes.
Bob,
Yes.
and I also vote yes. So the agenda stands approved as amended. Okay, next is public comment. Is there any public comment out there? Anything that a member of the public would like to bring before the Board of Health? If so, go to the bottom of your screen and raise your hand and let our technical person know that you wish to speak.
Michelle, I just got a message that the link on the website was not correct one. Do we have other people on that? Okay, so I guess I'm curious if some of the people on, like maybe Dave Askins or somebody has used the link from the website or
I'm not sure.
Okay.
I haven't checked the website mostly because I don't manage it.
yeah, okay.
Give me a second.
Okay, thank you. Sorry about that. I was just worried that we may not have public comment because,
Yeah, I just got a text from somebody who wants to be on it that said that the link's not working.
yeah, I'm going to have to go to my office to send them the right link. So I'm going to exit and I'll be right back.
There's a guest, Rocky, who said he could get on via the website link. So I'm not sure what's going on.
So there are actually two places that it's listed. One is the upcoming Zoom meetings page, and that one is the correct link to get to today's. There's also the events calendar, which usually has one listed there. And it's possible that that one has the link that's not working.
Yes, Rocky said I had to click the Zoom schedule of the upcoming meeting.
Yeah, it looks like the events page does not actually have it listed, so I am not sure where the link is that people are using that's not working.
There's Penny.
Maybe trying an old one.
Yeah, there are two separate links. There's one for one that repeats sometimes, but this one had to use a separate link.
Okay.
Oh, it looks like it's on the meeting agenda that has the incorrect link. Thank you, B squared.
Okay. All right. There were two that went out, so I'm not quite sure where that occurred. I did send the two people that asked me the link, so they should be able to listen just shortly. So sorry for that.
Michelle, do you see anyone yet that has public comment?
I do not see anyone with public comment right now.
We'll give them a couple of minutes, and then if not, we'll come back to that again later.
That's what I was going to suggest, is that maybe we move on, and as they get on, and well, I guess I see some people coming on now, so.
Oh, that was just me adding my laptop, sorry.
I think we're good to move on. We can always come back.
Yeah.
Back to that. Remind me if I forget. Okay, next is approval of the minutes. Did everybody have a chance to look at the minutes? Any corrections? I found one little teeny typo, and it was down underneath administration, paragraph 4. It says Ms. Cottle shared that a video, the harm reduction program, was featured, and it says "in has been," and it should be "and has been." nominated. That's all I found.
Also, the Roman numeral ordering of the items is not correct. It goes 1, 2, 1, 2.
Yes, it does. Very good, Mark. Anything else? Do I hear a motion?
I move that we accept the minutes with the 2 corrections mentioned.
We have a
Second.
motion and a second.
I'll
Carol
second.
has made a second. Okay, a roll call. George,
Yes.
Mark,
Yes.
where did Steve? Oh, Steve.
Here, yes.
Carol,
Yes.
and Bob.
Yes.
And I also vote yes. So the minutes stand as approved with those 2 corrections. Okay, next, is Margie here yet?
Not yet.
She was going to do our electronic attendance meeting policy. Penny, do you feel comfortable taking that, or would you rather she wait till she gets here?
If we can wait just a few minutes for her, that would be better. Otherwise, I will give a stab at it.
Okay, we'll wait for her. We'll go ahead and do our regulation review. You can do that, Penny. Tell us where our metrics are at and so forth.
I can. So we are officially in a blue advisory. We did make it there 2 weeks in a row. This week, as of today, we have over 45% of our 12 plus age group fully vaccinated and over 50% that have received at least a first dose. According to the data that I have, there's a little over 5,000 youth in that 12 to 15-year-old group, and it looks like we have vaccinated over 1,300 of them first dose. So the demand for this age group has been very, very positive. Certainly when that was announced last week and they became eligible, the hospital was seeing large amounts of walk-ins. IU saw a huge number of appointments and walk-ins on Saturday. So we're very pleased that people are bringing their children in, and as families, they are being vaccinated. So we're thrilled about that. Our cases per 100,000 this week, we're at 46, and our positivity rate is at 1.47. So things are good on that front. The health officer, of course, did last Friday announce the rescinding of the health regulations, health order as of Monday. And the one question that I had for you, and I sent a possible statement, if you as a board wanted to make a statement, just to remind people of what the recommendations still are, and that there are still some restrictions that people need to follow, and places where masks may still be required or other restrictions may be in place. So I did send that, and I think that Michelle may have a copy of that if you wanted to look at that. And it is totally up to you. It was just a thought that you may want to make such a statement. So totally up to you if you want to do that or not.
Well, why don't we have Michelle put the draft up on the screen for us?
Is this the correct one?
Yes, it is.
Excellent.
Okay.
So what you see, I don't really want to go through and read it word for word for you, but it gives a little bit of the clarity in the background with the Center for Disease Control releasing new guidance, what it's based on, what we're learning. And then really probably the highlights are those bulleted points that indicate what we are recommending people still do. So follow CDC guidelines, and we understand that those are going to continue to change as more is learned. I said this morning in a meeting that, you know, and people have said this before, it's not new to me, but we didn't, you know, lots of changes came into this pandemic last year. There were lots of changes. It was not an easy transition, and I don't think it will be an easy transition back out. Lots of adjustments to be made. We encourage everyone to get their COVID-19 vaccine and help others get theirs as well. So if someone has already received their vaccine, perhaps they can help somebody else get an appointment, get to the vaccination site, whatever it might be. If not vaccinated, then face coverings and social distancing are still needed in order to protect themselves and others. Wear a face covering where it's required, and keeping in mind that some of those requirements, and this will not be an exhaustive list, there may be others, federal and state buildings, including all COVID testing sites and vaccination clinics, public transportation, healthcare settings, and businesses that may choose to require them. So we want to just remind people they will encounter places, even if they are fully vaccinated, where they may still need to wear a face covering. Consider wearing a face covering and distancing, even after being fully vaccinated, if you're indoors in a public area, to support those who can't be vaccinated or who have a weakened immune system. Be respectful and cooperative with businesses and facilities that continue to require face masks in order to offer protection not only to their patrons and staff, but you know, whether they're vaccinated or not. It is difficult. We don't have a way to know for certain who is vaccinated and who is not. And then continue to use environmental controls, distancing, ventilation, outdoor air, cleaning to reduce risks for everyone, and not forgetting that if you have symptoms that we need to be tested, isolate, and or quarantine as needed if we are exposed.
Comments, board members?
I think this is excellent. One comment on the fourth bullet. Oh, boy. Okay. I wonder if you could put.
Sorry.
Right. Okay. So the last part is any business where required, and that might be a little confusing between required by law or required by the business itself. And we want to just be very specific that the business can implement a policy requiring a mask. So if you could say any business where required by that business,
Okay.
that might highlight that, yes, a business may actually choose to do that. And you must comply when they do that.
We could make that change.
Thank you.
The sixth bullet point kind of deals with that. Be respectful and cooperative with businesses and facilities that continue to require face masks in order to offer protection to all patrons and staff, vaccinated or not. So it's kind of covered there. It's always good to have it in more than one spot.
Yeah, I like it, you know, kind of pointedly stated that a business, you know, can require it. And then the respectful and cooperative is kind of a second thought.
I think you should bold the third bullet point, so it makes it very clear people who are not vaccinated should still be wearing their face masks. So I think that, you know, that's probably the biggest thing that we really need to get across is that you really, you know, until you get vaccinated, you still should be wearing a face mask.
Yeah, we can do that.
Yeah, the CDC did not change anything for the unvaccinated. If you're unvaccinated, nothing really changed. You still have to do all this stuff.
Right. And we should make that very clear in our statement.
I agree.
Yeah, and it's to protect yourself too. I mean, you say if not vaccinated, wear a face covering and practice distancing to protect others, but also yourself. Protect yourself and others.
Yeah.
That's true.
Graham's made a good point there. Fully vaccinated. Thank you, Graham.
Good
Really
point.
Good point. Yes.
And fully vaccinated means 2 weeks after your second vaccine.
Any other suggestions, changes? And then would you like us to make these corrections and have your chairperson sign it and have us post this on our website, on social media, release it to the media? How would you like to handle that? We can do it as a press release.
Can we make a motion to that effect that allows it, once it's been reviewed and signed, that it can be posted?
Yes, I would suggest a motion to accept at whatever point with the changes you've made, and you could leave the chairperson to determine that those have been done, and she could sign it, and then you could tell us how you want that distributed.
So moved.
I'll second that. George Hageman.
We have a motion and a second. We'll do a roll call. George,
Yes.
Mark,
Yes.
Steve,
Yes.
Carol,
Yes.
Bob,
Yes.
and I also vote yes.
And just for clarification, you want us to send this as a press release, a media release, and put it on our website and social media.
All the above.
All right.
Can I ask a question? Dr. Sharp probably is the person I want to ask this to. We are currently in the blue. And if we go to yellow or red, what happens?
And any change at all in status needs to be dealt with at the time. So my guess is with the immunizations going up and and the people that are have had the disease and now have some level of protection, I was saying a month or 6 weeks ago that this confluence of circumstances is going to lead to more and more protection and fewer cases. So I would be surprised, barring a problem with variants, I would be surprised if we had to deal with that. But we certainly deal with it on a daily basis. So we don't ignore that kind of stuff.
Okay, and my thoughts were if the public could see that we're in a blue somehow, I don't know if it's posted like a Penny, I don't know if you put a flag out in front of the health building, I don't know. There's something that the public can see that we're in the blue, and then if there's a change, they understand why we're gonna have to deal with that.
If we put a blue flag out, people will think it's a boy.
Well, so in terms of knowing what advisory we're in, that is on the state's dashboard, and their map, the advisory map, tells us what advisory we are in. I would say, like most other counties, if we were to start going back up, that we would have to evaluate whether that was because of a particular incident that happened that we needed to address, or whether that was more about total community spread that meant we needed to take wider action. For instance, if you had some sort of an outbreak in a particular facility, let's say that for some reason maybe raised our numbers, but was something we could deal with and contain without changing our community regulation, we could do that. On the other hand, if we were seeing a lot of community spread, then perhaps we needed to reconsider regulations as opposed to recommendations. Does that make sense?
It does.
And I think that's what Dr. Sharp was saying as well, that we would need to address whatever that concern was.
I know really watch this and we keep it in mind, but I'm not sure all the public is able to do that or even knows about the websites to go to, unfortunately. So that I had someone who came to my door this week and they came up and they said, boy, aren't you, open the door and aren't you glad they got rid of that health mask? You know, I don't think that everybody keeps up with things. Anyway, we made a motion and anything else you need from us, Penny?
No, I know that I did get a text from Margie. Let me see if she's
I see.
Looks like
Margie
she's
the
on.
oh,
screen.
okay.
Yeah.
Because I did have a text from her. She is coming, so.
Okay, next for our meeting, I'd like to introduce Margie Ross, our legal consultant. Go ahead, Margie.
Hello. So are you guys ready to talk about the electronic meeting policy?
You are.
Yes.
Sorry, thank you for your patience. I had overlapping meetings and it ran a little longer than I thought. So you should have in front of you somewhere an electronic meeting policy. And thank you, magic. So historically, Indiana did not allow governing bodies to have meetings virtually or electronically. Everybody had to be in person, and the door had to be open so the public could view and record your meetings. When COVID hit, the governor of Indiana declared an emergency and set forth procedures that we could meet electronically. That governor's executive order has been extended time after time, and his last executive order is set to expire May 31st. The General Assembly passed House Enrolled Act 1437 that allows for some participation electronically going forward after the emergency is over. And it has provisions that, and if you'll scroll down, you do have, every governing body has to adopt a policy if you want to have electronic meetings. If you don't adopt a policy, you'll be back to in-person meetings 100%. But if you want to adopt a policy, you can. And I've included the law that has passed in 1437 in this and it's just said that you're going to adopt those provisions of the law. And if you scroll to Exhibit A, scroll down just a little bit. Exhibit A here, I just cut and pasted that section 3.5, the new law. You can see that it says subject to subsection I, which are the meetings that you still have to do 100% in person. A governing body who is not physically, governing body of a public agency is not physically present at a meeting. And then it takes out some language and it says may participate in a meeting by electronic means, provided you do the following. So I can, in a nutshell, sum it up for you, which is half of the people can be in person, half can be electronically participating. You have to show your face and we have to hear your voice in order for your vote to be accepted if you're electronic. You can, a member can attend 2 back-to-back meetings electronically, but then the next meeting you have to be in person. And a member can't attend more than half of the governing body's meetings electronically. Roll call votes are still needing to be taken. In the minutes, it needs to reflect who was in person, who was electronic, and how they participated electronically. And then again, if you'll scroll down to I, there are certain meetings where you may not participate electronically. And those are things where you're raising taxes, exercising eminent domain, increasing fees. Let's see here. So here it is right there. A member of a governing body may not participate in a meeting if the governing body is attempting to take final action. So discussion is fine, but if you're going to adopt a budget, make a reduction in personnel, initiate a referendum, which you guys don't do, establish or increase a fee, which you might do, establish or increase a penalty, you guys don't exercise eminent domain, or if you're going to, raise a tax or something, then you would have to do that in person. I wrote into this policy that staff could still participate electronically. That governing body is what the legislature really cares about, the members who vote. They don't care about staff participation. and we've allowed staff to participate electronically, and it's been pretty helpful. So what I've said in the resolution is unless the chair of the meeting feels otherwise and says the staff person has to be there, and that's a call you might make on a meeting by meeting basis, depending on what you have on your agenda, that staff could participate electronically. So, and you can stop sharing the screen unless somebody needs to look at that now, but I'd encourage you to adopt this policy tonight. You can obviously, you can have stricter policies. You can't have more lax policies than what the General Assembly calls for. But if your choice is really adopt this policy tonight or just go back to 100% in-person meetings. I'm happy to answer any questions you might have.
I would support adopting the policy. I think, you know, it's sometimes challenging for people to come in. I'd rather have everybody there one way or another than only have, you know, 4 people there.
So that was a motion, right, Carol?
Sure, that was a motion. I'd like to adopt this policy.
Carol made a motion. Did I hear a second?
I'll second that motion.
Any discussion? Okay.
Let me also, can I say one more thing, is that if there is another emergency declared by the governor or by local government, the commissioners, section 3.7 of House Enrolled Act, that set 1437 says that we can go back to 100% electronic participation in the event that there is a statewide emergency. So, you know, again, we'll play that by ear if and when we have another statewide declared emergency.
Okay, thanks, Margie. We have a motion and a second. Ready for a roll call. Okay, George.
I approve, yes.
Mark.
Yes.
Steve.
Yes,
Carol.
Yes.
Bob.
he left the meeting.
He's already left, and I also vote yes. Okay, so the motion is passed. We will adopt that policy then. Margie, thank you so much for all your work once again.
Yeah, I'd also like to note that I think under J, there were some exceptions to that. 2, you have to do 2, and then you, like if for illness or things like that, there's some exceptions to you have to go do 2 and then not do 1 in person, I believe.
Yeah, that is a good point. And we can make sure that we send this out to all of you. If your absence is due to military service, illness or other medical condition, death of a relative, or an emergency involving actual or threatened injury to persons or property, then you can participate electronically. So what I was just on the Parks Board meeting, and what one member suggested is that prior to the meeting, the Parks Board members need to let the president, or in this case, they said the attorney, you could let staff know, you could to know how you're going to participate so that we don't get into quorum issues, right? So that we know who wants to participate electronically and who's going to be in person, so that if we don't get down to the date of the meeting and realize, oops, we don't have enough people in person. So I don't know, that may be something that Kay and, you know, Penny, you want to kind of think about and see how you want to administratively, how you want to handle that.
Penny, are you, I see you now. Usually people just on their own let us know if they're not going to be here, but we don't always hear. So I think it would behoove everybody that if you're not going to attend a meeting in person, then you let Penny or myself know, or both. Do you agree, Penny?
I do.
What about if you're in a remote location and you want to fulfill your duty of being on the board, and can you be on electronically for that?
Yeah, provided it's not one of those meetings that you can't participate electronically. And again, it says you can meet 2 meetings, you know, electronically, and then 1, the next one you have to be in person. So provided you follow those rules, yeah, you could do that. If you're, let's say, on vacation. Now, I did have one of the commissioners today said, you know, if you're on vacation and you're not, you know, you're on vacation, you still have that option to say, hey, I can't be at a meeting because I'm going to be in Aruba, you know, so.
Don't I wish?
Right.
it's also helpful if there's something important and you want to hear the discussion and you are in Aruba or wherever, that you can go on electronically and be part of the meeting.
Yeah. And now again, if you are going to actually vote and you want your vote to be counted, we have to see your face. We have to hear your voice. So whatever technology you're using, we have to be able to see you. Somebody else asked at another meeting. And again, every governing body is having to adopt this. So we're getting a lot of questions. Somebody just posed the hypothetical. What if in one meeting we're adopting a budget and then we have other things that are not in that subsection I? So what if I, for example, I'm remote, so I can't vote on the adoption of the budget because that's something you have to be in person for. But the next item on the agenda is something not on subsection I. Can I participate and vote on that? It's my understanding that you could. Your vote wouldn't count for the adoption of a budget, for example, but you could participate in the other things and vote.
Yeah, I see that as something we're going to have to keep up with, Penny, don't you? Okay.
Yes.
Next
can
on
do
our,
it.
yeah, next on our agenda, let's see, we're ready for public health reports.
Certainly. So I did just send a few things. Our vaccination clinics continue to go well. IU Assembly Hall Clinic is phenomenal. They are doing a fabulous job. And we continue to schedule various types of outreach. I think we mentioned before, we went to Crestmont Boys and Girls Club. We did about 60 vaccines there. We had a clinic for our Latinx and Hispanic community members. We did about 60 vaccinations there. We're going to Ivy Tech, to Smithville, to Richland Bean Blossom, to Crestmont. We've got a variety of things planned in the coming weeks. And today was our official our second dose clinic for our routine vaccination clinics, if I can get that right. So we still have second dose at Convention Center for that community clinic we did for our Latinx and Hispanic population. And there may be something else that occurs there in the meantime, but those clinics that we had and the one that we added, we have finished up those second doses.
I did have one comment that someone made to me. They
Sure.
had an appointment at Assembly Hall for a vaccination. And when they got there, there were lots and lots and lots of walk-ins that were ahead of them. And there was no line for people that had appointments. So the people that had appointments ended up in the back of the room from the people. So they wondered if there could be two lines, one for those that are appointments and
Right.
one for.
Certainly, and I will tell you that is an example of what I was saying before, that the interest in that 12 to 15 age group has just it exploded. And Graham has put in here, and I'll read it. There is a vaccine update. They have done over 34,000 doses, total doses at the clinic as of today. And over 17,000 doses for specific clinics and over 16,000 for the community clinics at Assembly Hall. So just kind of those numbers are great. They are aware. We did talk with them. I will tell you that IU Health was slammed with walk-ins as well. And there are so many registration tables at IU. I don't want to really speak for them, and I would be happy to let Graham speak to this if he wants to correct anything I am about to say or add to it. But they thought, because they have so many people at registration, that it would really not slow things down. And I know that on Saturday, they had over 700 additional appointments made, and then additional walk-ins. So it was kind of they thought that they had you have a plan for it. I don't want to say they thought they had a plan. They had a plan. And I think since then, it probably had to revise that a little bit. So it is unfortunate that people did run into that problem. On the bright side, it is fabulous that so many people are taking advantage of that opportunity. So Graham McKean, I would be happy to let you speak to the clinic if you would like to do that.
Sure, and thank you. And yeah, we did kind of have that thought and that consideration on Saturday, and we kind of went out through the line, and it turns out a lot of those people did have appointments. And I think the line on Saturday was kind of around the stadium even at one point. I think maybe people had about up to maybe a half-hour wait, even just to get to registration. But that was, we had over 1,400 scheduled appointments, plus all the walk-ins on Saturday. And then Monday, we saw 1,040 appointments plus walk-ins. But I think that was kind of our surge for that age group. We had 250 appointments yesterday and 550 today. So, we hope to get that back up, but I think things are operating quite smoothly now. And we've made a lot of adjustments since March 29th when we started there. University is going to be making an announcement about their plans for vaccination in the fall, maybe likely by Friday, and maybe that might result in an uptick as well, we hope.
Thank you, Graham, for your input.
Thank you.
So Graham, did you just say that the university is going to make an announcement about whether it's going to require vaccinations? Is that what that meant?
I think that was the implication, yeah. Right?
Yes, for Friday, yep.
Okay.
Ideally, maybe as early as Friday, as late as maybe Wednesday next week.
Okay.
I also want to remind people that rides are available to vaccination clinics. And if someone is going to a site that is state funded, and by that, I mean, that's where they get their vaccine from. So for instance, if they are going to Assembly Hall, then they will need an appointment. But if they have an appointment, they can call 211 if they need a ride, and they will give them a voucher. They'll confirm their appointment, and then they will send them a voucher for Uber. That individual will have to call and schedule that pickup with Uber, but it will get them to and from that vaccine appointment. IU Health also has a ride program as well. So there are means to get people to those vaccination clinics if they need them. We do continue to do homebound program. Our firefighters continue to help us reach those individuals who are at home and unable to get to a clinic, but have need of the vaccination. Maybe they simply just weren't ready yet, and now they're ready to go ahead and get vaccinated. They can still register through that homebound program through Area 10 on aging. Other things that are going on with the department, everything has been COVID for a long time, but nothing else stopped in the midst of all that. It's just been on top of it. So our disease intervention and STD grants, we've had those for many, many years, but that grant cycle has changed. And I may have mentioned this a couple of weeks ago. We did get our new funding. It is April through March. So we have separated that from the health fund, and it is now its own fund. But we also got a small amount of money for what's called Lost to Care program. And that is really dealing with people who have HIV infection and ensuring that they get and stay in care, medical care. And so sometimes people, for whatever reason, maybe they have that initial appointment, maybe they move or something, and now they're not getting any kind of treatment or care. So it really helps with case management to ensure people are getting the health care that they need. And we'll be partnering with Positive Link, as we do on lots of things, but we'll be partnering specifically on this so that we don't have one of our DIS trying to contact somebody and one of their case managers trying to to contact somebody. We'll be working together in concert to ensure that those individuals have the case management that they need. The job descriptions, I mentioned that we're going to counsel with that. Kind of the environmental health services division with an environmental health manager, and then a population health and outreach division with that population health manager as well. So we're excited to take those things to council. I did learn something new yesterday, which happened this fall, and I totally missed it. I don't know what was taking my attention that I missed this, but that 10 essential services of public health, that wheel that we have used in terms of what are the services of public health, changed slightly this fall. And I think it fits with some of the things that we've been dealing with. So if you remember that circle, kind of talking about assessment, policy development, and assurance. And in the very middle, it used to say research. And now it says equity. And so the wheel is really much more focused on assessing the population's health, not just kind of assessing and diagnosing. It's about investigating what are the root causes of things, communicating effectively to inform and educate, strengthening, supporting, and mobilizing communities. And so it's just kind of expanded and changed slightly, but to take us in a little bit different forward motion in terms of kind of staying with that maybe more old school approach with that. So I will share that with you, but that came to me from a webinar that I was involved in yesterday, tuned into, which was about racism in public health. And so I found that very interesting and wanted to share that with you. The other thing along those lines I want to share with you, and in some ways I am embarrassed about this, but I think it's a very positive move. So we've talked before, and as we talk about equity and racism and all those things, talk about language and how language matters. And some of our codes, some of the terms used as we go through various things have terms that if you have been in the field for a long time, you may not have given a lot of thought to until somebody says something and that light bulb goes off and you go, oh my gosh, why are we using this term? So we have made an immediate change internally regarding farmers markets. The market managers have typically been referred to as market masters. And we internally will not be using that term anymore. We will be using the term market manager, and we are taking that change to the state health department as well and encouraging them to make that change. So, you know, like I said, a little embarrassing on one hand, but when somebody just said, you know, I'm not going to refer to myself that way. And I'm like, oh my gosh, I totally understand why. And we can make that change. That was something that we could do immediately. So we are certainly doing that. And then the other thing that I would talk about is just that there may be a variance coming before you in your next meeting or so. We've had somebody just mentioned that they might do that. So I don't have anything official in that format at this point. But in talking about that internally, we've talked about lots of small property lots. And that may be something that as a board in the coming months, you want to think about, you know, we have a minimum of an acre set aside for septics for new installations. And so if somebody has less than an acre, if they don't meet sort of those minimum requirements, when do you want to hear a variance? What situations, what criteria would need to be met in order to have a variance heard? So just something to think about. do not think it's anything that you need to think, do, or act on tonight, but just wanted to throw that out there for you. And I think that that is all of my notes.
Yeah,
Anybody?
Tammy, I was on that same webinar yesterday, the racism.
Mhm.
It was really interesting in talking about, you know, how to bring communities together and to actually make change, because I think that's the hardest thing about the racism and equity issues is that, you know, yeah, we can all recognize them, but how do we actually make change? And I think that's, yeah, as things settle down with COVID and everything else, that's certainly something that I think needs to be on our agenda. And it's on our strategic plan, but it's something when we have time. And it's
Well, they
nothing's
also
going
said-
to change quickly, but
Right. Well, and I
Also
will,
said there would be a second meeting, but I didn't catch when it was. Do you know?
it's supposed to be in a month. And so
June
Penny,
7th.
yeah, pass that along to us when you get it, because we may get it because I was on it yesterday, but I really like to do the second meeting.
if I get that, I will certainly forward it on again, certainly. And, you know, there are so many things. Out of COVID, our group that has helped us with our outreach, that many of them are willing to continue to be an advisory group to us. And
That's
I
great.
think that will be a very beneficial addition to our work.
Good. That'd be really good.
Anybody else have questions for Penny? Okay, at this time, I think I want to ask once again, is there any public comment? People that couldn't join us earlier, is there any comment that you would like to make or let the board know about? If so, please raise your hand at the bottom of the screen and we'll recognize you.
There are no hands raised.
No hands are raised. Okay, we're down to board member comments. Anything anyone has? Mark?
Thank you. I think it merits consideration of because of the new CDC guidance and also the enabling policy that we just passed, whether we should consider coming back to face-to-face Board of Health meetings. If we're in the blue and the CDC says that fully immunized people can get together, then I think that that's something that we ought to consider is, you know, showing that, you know, sort of publicly that that's okay.
Well, since the orders that we're under now stop on May 31st, I assumed after May 31st, we would come into face-to-face meetings. Is that correct, Penny?
Yeah,
Legally,
you will have to be face-to-face, and you can have up to 50% of your members electronically if they so choose. But I understand how I interpret what Mark is saying is that he would propose that you have a actual face-to-face meeting for everyone the next time around. And I think going forward, you should be in person unless again, you want to have one or two members, you know, whatever is less than half, participate electronically because they need to for that meeting.
All right, so the order expires at the end of May, so the assumption is that we must. All right, so maybe I didn't understand the date.
right.
Yeah, so the executive order expires May 31st, and unless that's extended, then we are back to face-to-face with the exception of what's allowed in 1437.
Good, and I don't anticipate that we're going to meet before the end of May. It's the 19th now.
Well, we've been meeting every 2 weeks, and if we still continue that, we'll be in June in 2 weeks.
So that would be face-to-face. That's good.
So are we still meeting it for 2 weeks to determine our metrics and so forth, Penny? Don't you think we should?
I don't know if you need to meet every 2 weeks, but I think you definitely need to meet, plan for a meeting in June. We're going to be coming into budgets anyway. So even if there's no metrics to really hash out, we could spend a little bit of time talking about that. But I don't know that you need to meet every 2 weeks.
I personally don't think we need to meet every 2 weeks unless there's a change.
And we can always schedule another meeting if there's something we need to do.
Right.
When do we meet again, Kay?
Well, if we go to the second week in June and we meet on a Tuesday, that's June the 8th.
Is that in conflict with anything, Penny?
Does that work for everybody?
That's only 3 weeks.
That is actually, that's the same day as a council meeting. It is, so that would be a conflict. What about the 15th?
Works for me.
I will have to join you electronically that day, but I can do it.
Mark? Does 15 work, George? Okay, let's plan. The next meeting then will be June the 15th at
What time?
4:30.
4:30? Excellent.
Okay, I know when we were at our last meeting, George, you asked about staffing, and Penny has sent us some data from the state health department about all the boards and so forth, and what are all of the health departments and what staffing looks like. It's kind of convoluted because everybody has different ways of setting things up, and some count grants and some do not count grants and so forth. But I went through that, and to me, when I looked at it, I thought we, with the new positions we're asking for, we're in an okay position. Is there any questions you still had on that, George? How did you feel about it?
I have no questions. I took Penny's comments to heart. There are such large differences in the way different departments handle things. It's really difficult to make head-on-head comparisons. So I thank Penny for her research, but I have no substantive comments.
And I did notice, Penny, when we were looking at similar health departments in size to us, most of them had 2 people in the vital records, and you were asking for an additional person in vital records, which I could see that certainly would put us in with other people our size.
Well, yeah, and it is hard because it is hard sometimes to know if they have a registrar, what people title positions changes from health department, who they're using. I know some departments, for instance, their nursing division also is their vital records division. So that's where, they may have 1 or 2 people who are designated as vital records, but they're also working in their nursing division. And then, so that's part of what makes it very hard. But I will tell you that our vital records staff are extremely busy with 3.5. And like I said, they've taken that half-person position, and really we're bordering on not following the rules about that position. So, that's what I worry about with it, that it is almost a part-time but true vital record staff as opposed to a data entry person.
Well, it was really helpful information, and I look forward to compare it with 2021 data. But I had one other question for you, Penny. Have you heard any outcomes from the Scott County about losing their syringe program? Have you heard anything more about that?
I have heard more about it, and I don't know that they have taken the final vote, but I believe they have the votes to cancel that program. The newest, if I have this correctly, I believe it's the newest commissioner put out a statement that said they would not be supporting it. And I believe that they were that kind of swing vote, if I have the individuals correctly. So I think that it will be canceled, and which is very sad for that community. And but I don't think the vote's been taken yet.
Oh, we'll probably see those rates going up again. We'll see how they'll be dealing with it for some time to come. I didn't have anything else. Does anybody have any other questions or comments? Well, we'll have our next meeting then on June, what was it we said?
15th.
I've got my calendar here.
June 15th.
June 15th at 4:30.
Oh, and Kathy Hewitt just said that they put their vote off from today and will vote in 2 weeks in Scott County.
Okay.
Let us
Thanks,
know.
Kathy.
Let us know when you hear something.
Oh, well.
Thanks, everybody, for attending today, and we'll see you on June 15th.
Thank you.
Thank you.
Thank you all.
Okay.